When you go into an office and you're paid a couple $1,000s to tear somebody up, what are the things that you find are your top 10 failures?
Thanks, everybody. Welcome back. I'm Mike Russ with ProEdge Dental Water Labs in Denver, and I'm really happy to be talking to Dr. Stephen Haywood, who is the past president of the Baltimore County Dental Association. Among many hats that you wear, including the one you're wearing today, but you had done some terrific, like you said, you have created some excellent content that was actually helpful for people on compliance guidance, and it was coming from you, who had been through the dilemma of an inspection, and which has kind of focused you to become an expert in all of these things that the inspectors are looking for. Can you tell us if you changed anything? Most of your posts were last year, and they were really good. But would you change anything? Would you change any advice, or what would you give for advice coming out of in the short term, post-COVID? We're going back to work, probably soft launch. What kind of advice would you give your dental practices out there?
Well, Mike, I think when you do your rounds in your sales life, I'm sure that you're interacting with dental offices that really don't have a clue about waterline maintenance and the requirements. So I would say, I had to reflect on that question. You prompted me with that before we started filming, and rarely do offices even maintain a level of compliance pre-pandemic. So I think there's a lot of catch-up that's got to be done, and a lot of understanding about the basics of waterline maintenance, waterline testing. And if you look through some of the literature, even with the CDC, it's kind of obscure about what the protocols are supposed to be. And there's a history, and the history is documented in the CDC, how they, in 2003, they didn't even know what they needed to do. They were relying on manufacturers to give guidelines. Manufacturers didn't have guidelines. And so I'd say, for now, with regards to waterline maintenance, because that's probably the chief thing we want to be focused on here, it's one of the first things that inspectors will look for. They'll look for, because they know you'll fail. Their objective, if they come in from the board, is they're going to find the things that everybody fails at first. It's the low-hanging fruits, the easy find. And if you don't have a system in place, if none of your staff can communicate it, and you can't show that you have been doing testing according to the manufacturer's instructions of the system that you have purchased in your office, you're pretty much sunk. So I'd say first things at first, let's get compliant with the CDC recommendations. Take a real close look at that right now. And the literature is readily available at cdc.gov. And they have a thing called the Safe to Care PDF, and you can print it. Every office should pretty much have that 2016 document on the desktop in their office computer. And anytime anyone should come in, or anytime you should train, or anytime you should have a question about CDC compliance, which is usually your state board regulation, you're going to need to refer to that. So I would say get compliant with the 2016 standards right away, because never before have patients been so well educated about infection, aerosols, and they're going to be looking around, and they're going to be wondering whether this or that you are doing is a safe infection control procedure. So that would be my first thing. First things first, let's make sure we got a solid foundation of compliance moving forward. And certainly that's the approach that we're taking here.
Good for you. Well, that's actually excellent advice. Tell us about your experience with inspectors. One of the things you wrote last year was on top reasons. I think it was top 10 failures during
top 10. Yeah, top 10 failures. Top 10 failures are just failure to maintain high hand hygiene.
Oh, yeah.
So that's number one. And these were taken right from several of the inspectors. And, you don't have to know these people in an adversarial relationship either. Sometimes you just take their course. And so those are some, or you just know that they're teaching in the university. So you talk to them about them. You ask that simple question. When you go into an office and you're paid a couple $1,000s to tear somebody up, what are the things that you find are your top 10 failures? So hand hygiene, obviously being a number one. Waterline maintenance. We're going to, a lot of people don't know that OSHA has changed the standards for eye wash stations. They'll immediately go to your eye wash station, see if you're cleaning it, if you're logging those cleaning sorts of things, episodes. Whether you're changing, obviously everybody knows sterilization monitor logs, okay? The spore testing logs. In essence, the way to protect yourself most these days is just to have a log on everything. So all the things that you're held in compliance with, and everyone is very familiar with their sterilization log. Just do the same thing on your water line. Have a log on a sheet of paper. It doesn't have to, it's just a lined piece of paper. Every time you do something to that water line, even adding water into the bottle, putting an ICX tablet in if that's what you use, cleaning the bottle, running your shock treatment, doing your water line testing as you're supposed to. All those things should be logged. If you think about being able to prove what you do to any inspector, or just have good infection control procedures, make sure you have those logs in place, because that's what they're looking at these days.
That's awesome. If we like to say, if it's not documented, it didn't happen. And you've taken that to include everything, including, you said, including your eye wash station. Well,
the eye wash station, here's the thing, a couple of tips, and this is a free thing. You don't have to spend anything for this at all. Your local OSHA, not your dental board, your local OSHA will come in and do a compliance visit to your office at no charge. And so one of the first things that they'll look for, because they're industrial hygienists, they specialize in industrial safety. The first thing they're going to do is look at your eye wash station. And they'll show you that ANSI has changed the guidelines for eye wash stations 5 times in the last 5 years. And none of us in the dental industry know that this has even happened. So I think what we're looking at, and we're leading into a little bit of this discussion, of how does the dental board actually collaborate with us rather than work in an adversarial kind of situation. Get this news out. We all get the dental board newsletters. They come out from either state. Well, why not once a month? And why not about something that's cogent and important, relevant, and something that will allow us to not fail, but to pass a compliance test? So in any event, OSHA, you can contact your local OSHA component, and they'll come in and they'll basically go through your whole office for free. They will find violations, but you've got 30 days to correct all those things with no punishment whatsoever. They're essentially doing your work for you. And then you get a very lengthy document. And if the dental board should ever walk into your office, you already have a document that says that OSHA itself, the federal agency, actually inspected your office and you've been found to be compliant. And you have a document that says so. It doesn't cost you a thing. So you don't have to go to a dental supply company, get their infection control expert to come in, and so on and so forth.
And you can do that without the anxiety of the adversarial relationship compared to the dental board when there's a Department of Health dental board inspection.
That's right. And so we actually had this. I was informed about this when we were in a dental executive board meeting in Baltimore County. And there were some people that were actually freaking out about it and wondering what these people were about. Were they going to do random inspections for all of us? And were we all going to find ourselves under heavy punitive fines and such? No, I ended up calling the guys in, and they ran through. It was a very nice visit. And they showed me a lot of good stuff for the office, things that we had to shape up. And it was free. And it's you get the sense that you're getting your tax dollars worth. when you have these people come through and offer this kind of service. So these are the kinds of things you'd rather have a compliance visit than a complaint. Compliance visits are non-punishable, and complaints, they'll come through and they'll start writing you fines. So OSHA will work for you. They will collaborate with you, and that's something that'll help you out with things like that eye wash station sort of thing. People in the dental community really don't even know that regulation very well, but it is on the books.
That's great advice. And so you've had success with an OSHA compliance inspection that was non-adversarial, and they came in, they were helpful, they gave you the document, you fixed what you had to fix, but there was none of the anxiety of an inspection, of a adversarial type of inspection.
The key is you invite them in. You invite them in, you invite them to help you, and then they will. Now, I guess my agenda then, because I'm still involved with the Maryland State Dental Association, I'm a delegate, and in Baltimore County, I'm the chairman of our delegation. So, I have to, in my mind, have an agenda and a platform, and my platform is basically, still on compliance and collaborating and reforming the dental board, more in line with what we see in Ohio and a few other places around the country, where you can actually, the dental board acts not on a complaint-based system where they come in guns blazing, but more with a compliance-based system like the x-ray inspections that we have. So the Maryland Department of Energy or Environment will come in, and there's an inspection. If you don't change things, there will be a fine coming your way. But in general, it's a collaboration. And in this way, we can see a lot more people actually coming into compliance if we should do this from a CDC and an OSHA infection control standpoint or direction. So that's pretty much my agenda. And I think change is in the air. There are a few new dental board members that have this same feeling. And there are a few people that are giving, the seeds have been planted. And I think we'll see some fruit coming in the next few years. We'll see at least the argument being placed for bringing people more into compliance with CDC and OSHA regulations.
Well, I hope so. Wouldn't that be great?
Well, it kind of would. It'd be great for everybody, all the patients. There wouldn't be the angst that we have sometimes when we even think about the dental board. But more importantly, we'd all be on the same page and our patients would be safer. So it'd be a great community service. And I feel at that point, if the dental boards were doing that, they'd really be serving the citizens a whole lot better than going after a few and then ignoring the many. And that comes down to waterline things at this point for you, Mike. Got to be a lot of water tests that's got to be sold. You're right. That'll work for you.
I think you're aware of the level of current compliance in that category. It's just out of mind for most people. Still.
Yes. People don't understand it. I think a big part of your job is going to be information, and it's going to come down to people are going to be concerned about aerosols. Well, if that water line has Legionnaire's disease floating around in it because it hasn't been shocked or cleaned, or it has other bacteria that are transmissible, there are products for that. We have to provide drinking quality water in our water lines every time, and we have to have systems in place for that, and we have to now have testing, and you provide that product. I get no compensation from your company whatsoever.
None whatsoever.
But the product is there's no sense in complaining about it. It's our law. We got to test the water. Let's find something that works best. I particularly like the in-office tests, not the mail-in tests. That's my favorite. It's easy. It's once and done. The staff likes it. It's not a lot of mailing of things. That's my favorite. Other people like the mail-in product. whatever works for you. But we've grown accustomed to those. We find that they work quite well. So, and we're happy to do it. So, and we feel confident, and our patients know that we're on top of this stuff for them.
Awesome. Thanks for saying that. Thanks for doing this today. I appreciate it very much. Let's do it again soon.